Hi guys, this is Dr. Lee again. I'm an orthopedic spine surgeon. Today we're going to talk about spinal injections. So spinal injections are basically injections into the spine to decrease the inflammation and the pain. We typically do that if physical therapy and medications do not help you. So there's a couple of spinal injections that we commonly do. The first one is an epidural injection. So an epidural injection is for nerve pain. When a nerve gets pinched, such as from the disc being pushed back, it causes back pain radiating down to the leg or neck pain radiating down to the arm. And when that's the case and physical therapy has failed, we typically recommend an epidural injection. So basically an epidural injection is an injection such as for the back, we put the needle into the spine, but just outside the nerve where that nerve is being pinched, and we put in some numbing medication with some steroids or cortisone, which is to calm down the inflammation. The problem with the injection is that it's hard to know how much and how long it's going to help you until we do it, because everybody's different with it. It can help you for a few days, up to a few weeks, up to a few months, and sometimes even years. So it's very hard until we do it. And then in terms of the most common side effect with the injection, what we typically see is sometimes it can flare up some pain, or it might make it a little bit more sore at the area of the injection right after the injection, but it typically calms down. If it does flare up some pain, it will flare up some pain for about a few hours, up to sometimes a few days, and it'll calm down. So we tell people not to worry about it if that happens, and they can take some anti-inflammatory medications and put some ice on it. Another form of injection that we do for the spine is facet injections or medial branch blocks. So the facet joints are the joints in the back of the spine, and sometimes those joints can be inflamed and it causes just back pain without any leg pain or arm pain. When that's the case and physical therapy has failed, we typically recommend a facet injection or a medial branch block. And in that procedure, what we do is we put the needles into the joints or near the medial branch nerves, which would be near the joints. And we would inject some numbing medication with some steroids to calm down those nerves and the joints to see if we can decrease the inflammation and pain. The most common side effects, just like an epidural injection, sometimes it can flare up some pain or it might make it a little bit more sore before it gets better. And then in terms of how much and how long it's going to help, we just don't know until we do it, because everybody's different with it. And those are the two most common injections that we do in the spine: facet injections and epidural injections. And that's about it. All right, take care, guys.